Hi friends, welcome back to Land and Light of Knowledge. Today we are going to discuss a new topic, that is primitive reflexes. Primitive reflexes or reflexes in a newborn. So what are reflexes? Reflexes are involuntary movements or actions. Some movements are spontaneous and occur as a part of baby's normal activity. Reflexes check to determine normal functioning of the brain and nervous system. Some reflexes occur in certain specific periods of development. These reflexes diminish progressively due to the development of brain and nervous system. Primitive reflexes are also called infantile or newborn reflexes. First reflex is sucking and rooting reflex. What is the trigger? Touch the newborn's lip, the cheek, or corner of the mouth. What's the response? The newborn turns head towards the side stroke, opens the mouth, takes hold of the nipple and sucks. It disappears by 3 to 4 months. So sucking and rooting reflex disappears by 3 to 4 months. Next is doll's eye reflex. So when the infant's head is slowly turned to one side, the infant's eye will remain stationary. Doll's eye reflex is when the infant's head is slowly turned to one side, the infant's eye will remain stationary. It disappears by 3 to 4 months. Next reflex is swallowing reflex. Place finger in the infant's mouth. The baby sucks the finger rhythmically. It disappears as it is replaced by voluntary sucking after 4 months. It is replaced by voluntary sucking after 4 months. Next reflex is tonic neck or fencing. Gently and quickly turn the head to one side while the newborn is falling asleep or sleeping. Gently and quickly turn the head to one side while the newborn is falling asleep or sleeping. What is the response? As the newborn faces the left side, the left arm and leg extend outward while the right arm and leg flex. When the head is turned to the right side, the right arm and right leg extend outward while the left arm and left leg flexes. So the same side extend outward and the opposite side flexes. So it disappears by 3 to 4 months. The next is Palmar or plantar grasp. The trigger: place a finger in the palm of the newborn's hand and then place a finger at the base of toes. What's the response? The newborn's finger curl around the examiner's fingers and the newborn's toes curl downward. The palmar response lessens within 3 to 4 months and plantar response lessens within 8 months. Next is Moro reflex. Hold the newborn in a semi-sitting position and then allow the head and trunk to fall backward to at least a 30-degree angle. What is the response? The newborn assumes sharp extension and abduction of the arms with the thumbs and forefingers in a C position. This is followed by flexion and abduction to an embrace position. Legs follow a similar pattern. It disappears by 3 to 4 months. Next is swimming reflex. Placing an infant face down in a pool of water. The infant will begin to paddle and kick in a swimming motion. It disappears between 4 to 6 months. Next is parachute reflex. When the child is held upright and the baby's body is rotated quickly to face downward as in falling. What is the response? The baby will extend their arms forward as if to break a fall. It appears by 6 to 9 months, persist reflex thereafter. Next is startle reflex. The examiner makes loud noise or claps hands to elicit the response. The newborn's arms adduct while the elbows flex. Hands stay clenched. Disappears by 4 months. Next is stepping or walking reflex. Hold the newborn in a vertical position, allowing one foot to touch a table surface. The newborn simulates walking, alternatively flexing and extending the feet, resembling walking. It disappears by 3 to 4 months. Next reflex is Extrusion. When object is placed in mouth, the infant will push it out with the tongue. When an object is placed in mouth, the infant will push it out with the tongue. It disappears in 3 to 4 months. Next reflex is Babinski sign or plantar reflex. Beginning at the heel of the foot, use a finger to stroke gently upward along the lateral aspect of the sole and then move the finger along the ball of the foot. The newborn's toes hyperextend while big toe dorsiflexes and other toes fans out. It disappears after 1 year. So that's all for today. Keep watching this channel. If you are not subscribed yet, kindly subscribe our channel. Thank you.